So we know that a lot of you have questions about COVID as well as monkeypox. I want to bring in our medical expert, Dr. David Winter from Baylor Scott and White Health. Dr. Winter, right now, a lot of parents, a lot of people are getting ready to send their kids back to school, but vaccine hesitancy is still an issue here. What are you telling people who say, I'm not so sure about getting my kids vaccinated, especially when it comes to COVID-19?
Yeah, I'm very concerned about that, Sonia. This virus continues to spread. When schools open and kids start clustering together, another opportunity for it to spread even further. And the vaccines do work. Now, in clinical trials, Sonia, there were 0 serious side effects. And I've heard that only half of kids now are vaccinated. If you're 6 months and older, you're eligible for a vaccine. If you're 5 years and older, you're eligible also for a booster. So I hope parents will consider this because it's safe and it is helpful to stop the spread of this virus.
Now, Dr. Winter, what about these more variant-specific vaccines? Do you expect them to be available in the fall, as we've been reporting, or does that timeline seem like it might change? And I think a lot of people I know are like, you know what, I'm going to wait for that. Do you suggest waiting?
Yeah, as you pointed out, they're under development right now. They'll have to be approved and show that they work very well. I suspect that they will. Current target is sometime in September. But let me point out the current vaccines do work for the variants that are out there right now, especially if you had one recently. So if you have some underlying medical conditions, if your immune system isn't ideal, you might want to get a booster now if it's been more than 5 months since your last vaccine. You can still get another one later in the fall when they're available. So they do work right now. If you're healthy and you want to wait, that's fine. But some folks ought to consider refreshing their booster if it's been more than 5 months since the last one.
Okay, let's talk about monkeypox. The World Health Organization announced it's a public health emergency of international concern. The U.S. still hasn't gone that far. What does this mean when we talk about the World Health Organization making this sort of announcement?
Yeah, clearly they see the spread. It continues to spread. It seems like every week we see more and more cases out there. So we need to take some precautions about that. The other thing I'll point out, traditionally this began monkeypox when you had muscle aches, fatigue, fever, then lymph node swelling, and then you got this rash of these blisters, pearly white blisters on your face, hands, all over your trunk. That's the way it usually starts. But the newer cases now in America seem to be different. They skip the first phase and have just a few little blisters that tend to be in the private parts, under your underwear, so not hard to see. So be aware that it's out there and it's highly contagious if you have skin-to-skin contact.
Dr. Winter, I'm just wondering, what is the period of time where someone might contract monkeypox and not know they have it, and then figure out or, talk to a medical professional and find out they have it, and then have to kind of go back and think, okay, where have I been? Who have I been in contact with? What is that period of time?
Yeah, we call that the incubation period, and that is a concern because it can be a week or even 2 weeks from contact to first symptoms, which may be blisters or could be the fatigue, the muscle aches, and the fever. So you got 2 weeks there where you're building up and you can become contagious then also. So I think precautions need to be out there. It's skin-to-skin contact, very little spread any other way. So understand if you're around people, you have close contact, skin-to-skin contact, and they've got it, you may well get it.
And I just got to ask you this really quickly. Any way to treat it? Because there are a lot of people who say that this is a painful 2 weeks that you're talking about.
Yeah, it can be quite painful. The vaccines do work. If you've been exposed, get the vaccine. They're becoming more available right now. There's also an antiviral drug, tecavirimab. Now, it's hard to find, but that should become more available soon. A lot of folks are just kind of dealing with it. Anti-inflammatory medications, Tylenol, that does seem to help. But the best way is to avoid it in the first place, Sonia.
Okay, indeed. Dr. Winter, thank you for your time today.